So we all know about skin rolling. One of the things we can do with skin rolling, I like to call it shake and bake, is I like to move in a superior direction, I like to move in an inferior direction, lateral to the midline, and medial to the midline. You go up a little further, and you get the idea. You basically can do this almost from your iliac crest right up to the top. So again, we want to get that drag. Any pain or discomfort, Sean?
Nope.
Good. Just let me know. A lot of times, clients that get this type, and then if you want to give a little extra to the traps, same idea. So that's one thing you can do with your skin rolling. Next technique is pretty much fairly straightforward. It's more of a muscle stripping, and you can go either way. You can go, in school you're always told to go basically from the crest up, so you can see that. And where I usually like to go is just on the edges of where the transverse processes are. And I make my way up. Any pain or discomfort?
Nope.
And I adjust according to what I find. Some people say you've got to be careful with the scapula. I think that's just in the way you do your technique. You can move over towards the medial border of the scapula and get some of the rhomboids in there. Twitch there. So that's one way. The other thing you can do is you can also go the other way. And you just let me know, Sean, if you need me to increase or decrease or just to back off with my pressure. I'll do that one more time. Any pain or discomfort?
Nope.
And I can increase my pressure. I can even slow it down a bit. Sometimes this is very effective. A lot of times when we're doing deeper work, we want to go a little slower, let the body adjust to it. You can see here Sean is feeling. So from here, what I want to do now is I want to work this area here, the thoracolumbar fascia. When we had your client supine, we did the lats, we were grabbing up here. And one of the things I like to do is I like to do a bit of my lock. So I think what we'll do is we will use Sean's right side. And I'll ask Sean if you can just bring your arm up here. Good. So now what I want to do, and what I can do to test from here is, Sean, just push your arm back a bit into me here. And I can feel underneath my palm, here underneath my palm, push again, I can feel a bit of contraction. So what I'm going to do is I'm going to stabilize right here. And I'm going to ask Sean if you can move the arm forward and raise your arm straight ahead of you. And again, I'm locking in and back. Okay, so now I'm going to get even more into it. And again, do the same thing. Any pain or discomfort?
No.
And if I want, yeah, and back. Good. I can walk all the way. And again. And I like to do this cross body. And back again. And now, and go again. Get more of the muscle belly. Any pain? There we go. So now as we get further up, as you can see the arm's not higher. We found some tightness. And relax. So good. Any pain or discomfort?
Nope.
Okay, so now I'm going to move on to what's known as QL, quadratus lumborum. So the landmark for that, find the crest. And I know just about another finger or two space up is going to be the 12th rib. And there are a couple of ways. So the first way I'm going to show you we use with breathing. So Sean, take a deep breath in. And let it out. Any pain or discomfort?
No.
So I'm pulling back. And again, deep breath in. And let it out. Good. And one more time. Deep breath in. And let it out. Good. Okay, so we've done it that way. The next way, same idea, except this time what's going to happen is I grab on, similar to what we did with the lats. Okay, Sean, if you can just raise that arm again, the right arm forward.